We're talking today with Dawn Rabideau, who is a clinical massage therapist, a graduate of our medical massage master class. Dawn has a practice of her own, a spa, but also has a unique relationship with a chiropractic's office, and I'll let her tell you about that.
I had a spa and I did aesthetics. I did body treatment, sugar scrubs, body wraps, facials, chemical peels. I had been hiring massage therapists instead of doing it myself. And at some point, I just decided I'm going to do this myself. I knew the first day of class, this is where I should have been. And I waited all those years. Sometimes you just got to get out there and do it and try it and see what happens. Just take the leap. And I graduated top of my class, but I graduated feeling like I don't know how to test somebody for range of motion. They showed me a goniometer, but they didn't show me how to use it. And it's not fair to the client for me to just go Google it and then go in there and pretend I know what I'm doing. So I knew I needed to take the medical massage course. Texas recognizes us as massage therapists. They recognize us as healthcare practitioners. I didn't really feel like a healthcare practitioner because before this course, I didn't know how to do a proper assessment. I didn't know how to properly test range of motion. I really didn't have a good scale for measuring their pain, but David really helped with that. And because he put it in audio, text, I got to see it, I got to hear it, I could read it. There were demonstrations and presentations and webinars, and it just allows for multiple learning types. This class provides help with the critical thinking skills that you need to make the proper assessment and come up with the proper plan to help them. Not necessarily, we're not always going to completely get rid of it, but we can help them make it manageable. The class really helped me with that because we took the body in segments and we considered pathologies that usually affect those segments, and it really helped me to put it together better. And because I have a better understanding, now I can do a better assessment. I know what I'm looking for. If I don't know, I have a better understanding of how to find out.
How does that make you feel?
More competent, definitely more competent. I was a little overwhelmed at first. You know, you get the manual and all the modules, but it didn't take me long to figure out. It was my first couple weeks. I was like, this isn't hard. If you just put a little bit of time into it every week, just a little bit, couple hours a week, you can do it. And the nice thing is you have the manual, you have the videos to go back to, you can rewatch the webinars anytime you want to, you have the group to talk to in chat, so the support is there, and I love that I can go back, because you can't remember everything, so I love that I can go back and refresh on a topic, and I do. I just go flip through there, find the pathology, look up the test I need to run, and then take them back in the room and run that test before I get them on the table. And then once they're on the table, I can work on that problem. They can keep their clothes on. I don't need them to undress so I can work on a shoulder. I don't need them to undress so I can work on their hip. Because I've been doing some clothes on work, I can feel through the clothes. I've learned to feel it. What I've started doing since I took this course is, instead of taking them in there, and it was a transition for me, I had to learn it. Instead of taking them in there and doing a full body massage, now I ask them, do you have an area that hurts today? And then we go through the motions. I'll have them do flexion, extension, what have you, so that I can see what they can take and I don't push them beyond it. And then I'll tell them, you can leave clothes on or clothes off. I can work with you either way. And that seems to make some of them feel more comfortable because nobody asked them to take their clothes off. This course has helped me personally because David makes sure that we know the proper way that we need to be stretching ourselves, and reminds us, you know, it's easy to forget sometimes to use proper body mechanics. There's no reason for me to lift a 300 or 400 pound person's leg and hurt my back and shoulders. Doing improper massage is going to make me hurt more. I have to be careful of that. So David's reminders, that we don't need to do it for them, tell them to do it. That's part of their job when they're on the table, not our job to lift their limbs. That I needed to hear that because I was doing it all the time. I hurt a lot less. And I feel like it's helped me with my patients in another way too, because now that I'm asking them, say I work on their leg for a little while, addressing where they had a trigger point or where they're feeling the pain or referred pain, and then I say, I need you to pick this leg up and move it over here off the edge of the table. Well, if they still can't pick it up after I worked on it, then I need to do something different. But if they couldn't pick it up and now they can pick it up, I know I made some improvement. So it's really helping me to gauge the progress of the treatment by letting them do that work instead of me doing that work.
Do you use the thumb savers?
I do, and my thumbs hurt so bad all the time. But I do use the thumb savers, and my favorite, I always forget what it's called, but it's the larger one because I can use that going up the back around on the outside of the laminal groove where the muscles start to go up from the erector spinae. I can use that there when I find a trigger point instead of digging in with my thumb.
Did it take a while to learn how to use the thumb savers, how to feel?
It did take me a little while. The first couple weeks I was like, this isn't going to work. But it does work because you learn to gauge the pressure that you have in your own hand. The tool is only going to distribute the amount of pressure you give it. So when you learn to gauge how many pounds per square inch you're sending through your arm, then you're going to know to hold back a little bit or lean forward a little bit. I find for me, less talking during the massage. So I don't get distracted and I'm paying attention to what I'm feeling. In fact, sometimes I just close my eyes and think about what am I feeling? Where am I feeling it? And so that I'm not looking, that's not good for my neck to be looking down at them. I need to have my head up so that I don't hurt my own neck. So that's good anyway. So I've just kind of gotten used to closing my eyes and feeling the weight in my arm as I press it down. Before I did the medical massage, I considered myself an intuitive massage therapist. So I don't think being an intuitive massage therapist means you can't do medical massage, because you're going to put together what David teaches with what you have learned to feel and read from yourself and your patients and make it your own. But you're still going to learn a host of pathologies and assessments and tests that you probably barely covered in school. Maybe some schools taught them, but I took a decent course, and I graduated feeling like I didn't know enough. I was terrified somebody was going to come to me with a real injury. I didn't have any confidence in what I knew because I didn't know the testing part. I didn't know and understand the pathology part enough and the assessment part enough. And if it hadn't been for the medical massage course, yeah, some of it was familiar. It's like, yeah, we learned about that. But we didn't learn about it on this level, and that's different. It's the difference between a hot dog and a steak. They're both meat. I'm proud that I took David's course. I feel more confident. I feel more competent. And my patients, both at the clinic and at the spa, are excited about it. And they feel more confident in me. They're like, now they'll say things like, instead of what do you think, they'll say, you're the boss. You tell me, you know what you're doing. And they didn't say that before I took this course. They didn't say I didn't, but they weren't exuding that same level of confidence that they exude now. They feel it. So I'm super happy. And once I was doing it, I knew that feelings started coming up and those thoughts started coming up right away, that how am I going to get in touch with doctors? How do I get them to see the value of what massage can do? Completely unrelated reasons, I was contacted by a chiropractic office, and in our conversation, they were mentioning things about needing massage therapists, and I kind of jokingly said, because I already had a practice, "Oh, I'm a massage therapist. I wish I could help." And then they asked me, "Well, can you come in for an interview?" And I said, "Well, I already have a practice, so I would think that would be a conflict of interest for you." And they said, "Well, just come in for an interview." So I went in to meet them, and they liked me, and the doctor asked me to work on her for a few minutes. And she had a problem anyway, so I addressed it. And she asked me if I could work in her clinic. And I said, "Well, I can't work full time in your clinic because I have a business, but I do have one day a week that I don't practice. I just use it for administrative purposes. And if you would like that day, we can try it out." Right away, there were great results coming out of the treatments. The patients are usually doing 30-minute to 60-minute sessions. And obviously, for most of them, they're there because they have chronic pain or injuries. So since that was the path I wanted to be on, to me, that was an open door. They bill insurance, and I get 40% of whatever insurance pays. They keep 60 to cover the fact that they're paying for the person who's billing insurance, and they're taking care of the laundry and the scheduling and the booking and the rebooking and the follow-up calls. And if I tell them, I need anything specific, they take care of everything for me. In my practice, I'm going to get the full fee. There, I'm making a little bit less, but I'm building a practice that is going to follow me. And some of them have. On days that the clinic is closed, they will call me where I am and ask me if they can get in. And the office manager at the clinic has even called me and said, "We have a patient that needs to get in and you're not at the clinic today. Can I send them to your place?" I have a couple of patients that are nurse practitioners, and they both have injuries. They experience results with their medical massage with me, then they can make referrals. As a healthcare practitioner, they could tell people, "I think that's where you need to go." So it builds my practice. And if I'm not in a clinical setting, I'm going to meet less of those people. The other nice thing about it is that while I don't want to take their massage patients, I feel like that would be unethical. But I have had massage patients from the clinic who wanted other services that we offered, who now come to my place, to get their facials and their body wraps, things the clinic doesn't even offer. So it's not hurting anybody. And it grew my business. So it's a good relationship because one way or another, it's going to benefit my practice. There's so many things about this class that it just provided answers, provided solutions to problems I was trying to figure out how to solve. I can't say enough about David's class. I'm going to get emotional.
I get the same way. You've seen me on some of the webinars. When being able to support this work the way that I do is such a blessing in my own life. To take, because I made all those videos and I constructed. You talk about the design and how this course works really well for you. Well, I designed all that and put all that together. So it's a blessing for me just as well.
Thank you so much for letting me be part of this.
No, thank you. It's fabulous. So I so appreciate it. Thank you very much.